it's really boring, right? So in other words, we're looking for a kind of Reflexartigkeit, or a kind of spontaneity in how we present our voice. To this end, I'd like to do an exercise with you, and then take 2, maybe 3, maybe 4 people and do a demonstration at how quickly it can actually happen that you get in touch with your vocal qualities. So sit in a comfortable position, with both feet on the floor. And I'd like you to close your eyes and take slow, deep breath through your nose. And just notice all the things in your body that go straight down and straight up. There's a lot of things to notice when you have your eyes closed and are breathing slowly. What sensations give the signal of going straight down and straight up? Okay, open your eyes. Who felt what? Let's hear.
Your shoulders.
Your shoulders. They go straight up and down. Anything else?
The chest goes up.
The chest goes more like out. Okay. Is there anything you felt that went straight down?
Diaphragm.
Yeah, and you can feel your diaphragm. How do you feel your diaphragm?
Well, it goes down when I breathe in.
But how do you sense your diaphragm? Because the innervations, the afferent nerves into the diaphragm are almost no.
Well, what I feel is
yes.
my stomach expands.
Okay, anyone else feel movement in the stomach? Okay, so now do it again. You notice the stomach goes out. In other words, there's a lateral expansion. So the first thing I'd like you to do is the hardest thing, to notice what goes straight down. So feel between your sitting bones what you sense that goes straight down. So, we're talking about an intimate area, but I mean, you can also feel it in your spine here. The spine sort of lengthens as you breathe in. Okay, so do it again, and this time feel anything that expands. Like you said, your stomach in this direction, your chest in this direction, your ribs in this direction. Just observe and feel anything that goes from the center to the periphery laterally. Yeah. Okay, that's clear what goes on there, right? That's what you mentioned is the lower area of your stomach goes out. You can maybe feel this area over here also tilting, and your ribs over here go to the outside. Okay, so now observe, do it again, observe anything that goes up, like your shoulders. Excellent. Okay, everybody feels those 3 dimensions of breathing. Okay, so your diaphragm is here, and when you take a breath, the diaphragm falls. Und es erzeugt negative Druck. That means air flows into your lungs. At the same time, it produces positive pressure in the lower area. So if your stomach and your pelvis is ready to allow that pressure, then your larynx sinks. And then you have more ability to produce partial strengthening. Okay. Any questions? Okay, so I'd like to use this handsome gentleman as my first victim. My first. So put both hands on your chest and imagine that you're affirming something by saying, mm-hmm. 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 Genau. Mm-hmm. Mm-hmm. And find the tone where you can feel mm-hmm, the most resonance. Mm-hmm. Close your eyes and keep doing it again. That's way too low.
I felt most resonance.
Yeah, but it's not the loudest resonance, not the most intense resonance. Mm-hmm. Mm-hmm. Yeah, that's it. Mm-hmm. Yeah. Too low. Feel this area? Get out. Yeah, let that go. Let that go. Too low. Yeah, keep trying again. Yeah. Get out. Okay, now spend a little bit more time on the M. Yeah. And move your mouth a little bit around. So you can really feel it resonate.
I will try.
You can do it, man. Come on. Yeah. Yeah, not too much. You're trying to find the optimal space in your larynx. Too low. Okay. Open your mouth a little bit. Enough. That's your tone. Okay, so this one tonal area, it's like, you know, you have a Coke bottle and you go like this, and that Coke bottle has a special tone. He's got a special tone too. We just found it. Okay, so observe that and now count on that tone from 1 to 10. 1. Yep.
2.
Yep.
3.
Yep.
4. 5.
Ignore the audience just for a second and feel into the ear. Yep. 7. Yep.
8. 9. 10.
Okay, do the same thing without your hands and feel where your hands were. 1. Yep.
1, 2, 3.
Gewöhnungsbedürftigkeit.
Oh yeah, you do this one.
See, well, what happens is you all of a sudden get real private, you know, and you go inwards, but there's people watching. So there's sort of like, oh my God.
Yeah.
So and getting used to that process of doing something extremely intimate and extremely personal, like phonating, and then doing it in front of a group takes practice. Yeah. So because most of the time when you're excited, your voice goes up, it gets a little bit breathy. It's like, oh, these people are watching me, and you forget to get in touch with the midline of the tone that you're feeling. So that's what we're practicing. It's not easy. You're doing real well. Do it some more. No, we're not done yet. We're not finished. Count to 10 again. 1.
With my hands or without?
No, without. We've already anchored it here. 1.
1.
Yep.
2, 3, 4, 5.
Yep.
6, 7, 8, 9, 10.
Okay, now open your eyes and lift one leg. And do it again. Your eyes open.
Okay. 1.
Yep.
2, 3.
Yep.
4.
You notice the difference?
5.
Yep. Yeah. What was the difference that you noticed?
His tongue went up.
His tongue went up a little bit. The voice got a little bit more warm and a little bit louder. In other words, the lower parts were being strengthened more.
Okay.
Why is that?
No idea.
Okay.
More pressure in the
As
lung?
soon as you lift one leg, your psoas, iliopsoas, and iliacus shortens, and your diaphragm sinks more in the back. Plus, you're preparing yourself to do some kind of a action, and the vocal lips are contracting more, and we have more vocal lip mass. So, of course, you can't give speeches like this. So, we're going to integrate that now. And you do it again. Count from 1 to 5 in this position, and then bring your leg back down again, and leave the tone exactly the same, and then finish 6 to 10.
One, 2, 3, 4, 5, 6,
Leg down. 7.
6, 7,
Yep.
8, 9, 10.
Do I have time for one more?
Of course.
I need a woman. I need a woman.